Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Respected judges, designated guests, and fellow speakers. It is 3 o'clock in the morning. The hospital corridor is silent except for the steady beepings of monitors. A final year nursing student stands alone, staring at a medication chart in her trembling hands. She has just realized that a dosage she calculated hours earlier was wrong, and it has already been given to the patients. No one saw the mistake, no supervisor is watching, no camera is recording. The only witness is her own conscience. In that single, suffocating moment, she has two choices. She can stay silent and hope the patient recovers without harm, protecting her grade, her reputation, her pride. Or she can walk into a nurse station, admit the error, and risk everything she has worked so hard to do. And she chose the second path. That, ladies and gentlemen, is the voice of integrity and is exactly what I want to speak about today. The voice of integrity shaping a compassionate healthcare future. We often imagine integrity as something abstract, something philosophers argue about in lecture halls far away from real life. But in healthcare, integrity is brutally concrete. It is the nurse who double check a dosage instead of assuming it is correct. It is the medical student who says, I don't know yet, instead of guessing just to look competent. It is the pharmacist who report a small labeling error, even so staying silent will be far more confident and almost certainly no one would ever notice. Integrity asks one simple terrifying question. What do you do when no one is watching? Healthcare, more than almost any other professions, happens in private moments, behind closed curtains, behind closed doors, in the quiet hours of the night shift. In this private moment, the only law that truly governs us is the law we have written inside our own heart. Now, why does this matter so deeply? Because the most valuable thing patient ever give a healthcare worker is not money, and it is not passion while waiting in the crowded clinic. It is trust, blind, complete, almost irrational trust. A patient lies down on an operating table and allows a stranger to cut into their body because they trust that strangers competent and honestly. A mother hands her carrying infant to nurse she met only a minute ago because in that moment she trusts that nurse more than she trusts her own fear. That trust is fragile, invisible, and once broken, almost impossible to fully repair. History has shown us what happens when that trust is betrayed. Researchers who quietly altered data to make a drug look safer than truly it was. Hospital that hid statistics about infection rates to protect their reputation. Professionals who stayed silent while watching unsafe practice happen right in front of them. None of these scandals began with one dramatic decision. They began small, a tiny shortcut here, an unreported error there, a comfortable silence repeated until it became habit. Integrity, once eroded in small pieces, eventually collapses entirely, and when it does, it takes public trust down with it. But integrity alone is not the whole story. A healthcare worker can be perfectly honest and still be coldly transactional, treating patients as case numbers instead of human beings. This is exactly why our term links integrity with compassion, because they two cannot be separated. Integrity without compassion becomes rigid bureaucracy. Compassion without integrity becomes empty sentiment that collapses the moment it is truly tested. Picture a young doctor who must tell a final family the truth about a terminal diagnosis, chooses to tell them honestly instead of offering false comfort. Is integrity. But the way that she sits beside the mother instead of standing over her, the way she holds her trembling hands, the way she chooses words that wound a little less while still remaining the truth, that is compassion completing integrity. Together, they transform a clinical encounter into a genuinely healing relationship. If you have ever stood beside a hospital bed, you have probably noticed the small green line in a monitor screen, rising and falling, never stopping, never lying. That line cannot be persuaded, bribed, or convinced to show something false. It simply shows what it is real. I believe integrity works exactly the same way. It is the quiet, steady pulse running beneath every action a healthcare professional takes, whether anyone is checking that pulse or not. This is the future we are responsible for shaping, not a future built only on better hospital or newer machines, but a future built on a healthcare workers whose internal pulse of honesty never stops, no matter how influenced this honesty might be in the moment. Because patients can sense almost instinctively when someone is being honest with them. The sense of trust one given becomes the foundation for every treatment, every recovery, every healing relationship that follows. Let me return to the nursing student from the beginning of this speech. After she reported her mistakes, the medical team caught the error in time, adjusted the treatment, and the patient recovered fully. Her supervisor did not punish her, instead, she said something worth remembering. Thank you for trusting with the threats. That's look more courage than getting the dosage right in the first time. That is the future we are capable of building, a future where courage is rewarded more than perfection, a future where speaking up is seen as strength, not a weakness. Every future where every frightened young healthcare worker standing alone in a quiet corridor in the middle of the night knows exactly what their voice should say. So I ask each of you here today, when you are standing in that corridor, chart trembling your hands, what will your voice say? Will it whisper confidence, actions, or will it speak the inconfidence truth? A stethoscope let us listen closely to any person's heartbeat, but integrity it is the instrument that lets the world listen to ours. Let us be the generation whose pulse never flatlines, whose honesty never stops, and whose compassion never runs out. So that every patient who ever lies down before us can trust without hesitations that they are finally truly safe. This all concludes my speech today. Hope all that can leave big impacts on us. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.